All right, so today we'll be doing intense pulse light or IPL. It's technically not a laser, it's actually a spectrum with filters on each end of light that targets the reds, which gets you that kind of like red spots, sunspots, as well as the brown sunspots on the face. So it's great for sun damage, poikiloderma would be the term for that. So we're going to do the face area here. So the patient has cleaned her face well, there's no makeup or anything like that. And we're going to go ahead and proceed with a little cooling gel to the area. So this is aloe, and it just conducts the light energy to the skin better. So I picked the settings based on her the sun damage I see as well as her skin type. So we're going to do a little test patch here. So how's that feel? Okay? Mm-hmm. Yep. Okay. So now we'll just cruise along here. Now it gets a little warm, so our patient will tell us if she needs a break, and we can always ice for a moment and then proceed.
Ooh, maybe a break.
Okay, and we'll go ahead and ice that.
You go ahead while I have ice.
Yep. So we'll go ahead and go over here and hit this part here. This is going to be a little zingy. Boom. 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 And boom. Okay, now we'll go ahead and look straight ahead. And we'll go ahead and do her chin here. Kind of continue mowing along here. You all right? One more. Mm-hmm. One more. Good. Okay. One and one and one. All right. I'll go ahead and do this portion. Oh, you got some? Okay. So now as this flashes, it actually flashes two lights very quickly that are in one click, and that helps target both the reds and browns that I talked about. And so the tip is actually cooled. It feels cool to the touch, and then as the pulse goes up, it gets really warm. Now, over a man in the beard area, it can actually cause some hair loss. So we tend to avoid that in males with a darker beard hair who don't want it to be removed. It's not often permanent, but you can cause some permanent hair loss with it. So you want to be very careful around the eyebrows, of course, as well, and then the edges where the hair grows, edge of the face there. There we go. Good. All right.
Like the mandible and central face. The rest of it doesn't really hurt.
Yeah, and then this is going to be fun right here. Ow. One more. Oh, yeah. And then we'll do the nose here. Another one. Boom. Side of the nose. 1, 2. And flip it around. You just make sure the tip is in good contact with the skin. Now, if you did a little too much, you can cause some blistering, peeling, and then you run the risk of scarring or superficial infection as well. So we got most of the lower face. We'll go ahead and do the forehead. Now, so this young lady doesn't have a lot of sun damage. So one treatment, she'll see some significant improvement. People that have a little bit more may need to do 2 or 3, depending on how much they have. And this is great. You know, you can do this on the face, the neck, the chest, even the arms and legs, depending on which areas are really bothering you. So it's very versatile all over the body. It's a little zingy on the lateral forehead. Take a break there. Brooke's doing very well here. Do like one like this. Boom. 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 Now I can put my finger on so I don't hit her hair, and that way I have a little block there. I'll go ahead and do it here in the middle. Okay, and we're done. So how was that?
Not bad.
Not bad? Yeah, so we did no numbing or anything like that. Now she's going to be a little red and puffy for the next couple days. Sunscreen is very important, so she needs to be very diligent about her sun protection. Other than that, in 3 days she'll be back to normal. These dark spots will get a little darker, and then they will just kind of peel off on their own as their skin sheds. I'm going to go ahead and turn up the warm setting so I can hit the browns a little better and go over these areas that have a little bit more brown pigment. So grab some stuff there. We'll just kind of do this the driver's side here. Excellent.
Snuck that one in.
Okay. All right. You can take your eye shields off.
They're running